In 1855, Dr. Marion Sims believed that infertility could be cured with the use of gynecologic surgery. The first reproductive medicine clinic opened in 1926. As the science of reproductive endocrinology progressed, IVF became more intriguing for gynecologists. In 1978, the first IVF baby, Louise Brown, was born in England. In 1980, the U.S. opened their first reproductive endocrinology clinic, and by year-end, they had performed 23 IVF cycles, and no pregnancies resulted. At the release of this documentary, IVF is only 39 years old. Around 1.5 million ART cycles are performed each year worldwide, with an estimated 350,000 babies born. That is a 23% average success rate according to the European Society of Human Reproduction and Embryology. Our goal is not to sway you from working with medical professionals. It's to help you with your fertility challenges. We invite you to think critically to make healthy decisions about the path that you choose. Reproductive endocrinology is a young branch of medicine, and much more attention is needed to help the future of women's health. Right now, it's invasive and not effective in most cases. Frankly, we're still uncertain of the long-term health implications imposed on women and their unborn babies. I'm not against ART. In fact, I help women to optimize their health for the best chance of success. I am not out to demonize IVF, but it is important to make sure that each woman is informed as to what is best for her. Often I'll collaborate with other medical professionals to find the best route. Not every woman is created the same. Some fertility challenges can be very simple, while other cases can be very difficult. Mercier therapy is all about a custom-tailored approach for each woman. It's personal and non-invasive. With that, I give you Fertility, the shared journey with Mercier therapy.
My infertility is a blow to my self-esteem, a violation of my privacy, an assault on my sexuality, a final exam on my ability to cope, an affront to my sense of justice, a painful reminder that nothing can be taken for granted. My infertility is a break in the continuity of life. It is, above all, a wound to my body, to my psyche, to my soul.
So, what would be the first thing that you would seek out if you were having trouble conceiving?
I would probably go to a fertility clinic.
On the internet, I've read blogs about it, but I've never personally spoken to anybody who's spoken to me about it.
I would talk to a doctor.
I think I would meet with my physician and discuss the options that I had in terms of my budget and insurance and, what was available.
In vitro.
In vitro
fertilization.
Exactly.
When a woman wants to have a baby, that's all that's on her mind is baby, 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 and by any means necessary, which is an approach that I think as Americans, we want the quick fix. And sometimes we need to examine the problem versus looking at an immediate solution.
We do, I'm sorry to say, in this society, invade on our women quite a bit. And it will be better when we do less of that and do less invasive procedures to help women bear fruit.
A lot of the women who are struggling, they're just wanting to take medication and get pregnant. And they're not really understanding the whole background, the whole physiology with maybe their organs are not properly aligned, maybe their nutrition is not what it should be, maybe endocrine-wise there are other factors that are affecting this, and they keep trying to do the same thing, getting the same response, which is not becoming pregnant.
Utilizing drugs that suppress your ovarian function just to super ovulate them in a couple of weeks is really dangerous practice, and it's being used every day. There are 154,000 IVF cycles done in the United States in 2011, according to SART. Only 29% of those resulted in pregnancy, 26% resulted in live birth. Those numbers are not nearly good enough for me.
what's going on now is people are rushing to the end, just do it, I want to be pregnant. And they're not stopping to think about it. And actually the best example of that was when I left the field and I started to work with some people on some other initiatives I was working on. They asked me to give a talk. And I had no idea what I was going to say. So I decided I'm just going to give one of my fertility talks, but to a room of women, people who are not infertile. It horrified them. More than I ever would have dreamed. When you started to show film of retrievals, when you started to show film of embryo transfers, when you started to show the process and the ultrasounds of the ovaries that were stimulated, people who have never been in this world don't know. They just think you go in, place an order, and a baby comes out the other end. They don't realize all the things that people go in there. And then when you tell them that this is, first half of it is what we do to these young women when we pay them all this money to become donors for us.
My mother used to run a daycare facility, and one of the women who had a child needed an egg donor, and she asked me to be the egg donor. And the same questions that could not be answered for me then still cannot be answered for me now, which is why I chose to not do it. But it was, is this going to shorten my fertility? Is this going to put me in the early menopause? Is this going to hamper my chances of getting pregnant? I asked all these questions, and there was a lot of, we don't know, we don't know, we don't know. It's still the same question. They still exist, and the answers are still the same. We don't know.
In the past, I did offer the full service of reproductive options, including in vitro fertilization and artificial insemination, male infertility treatments. However, I left that all behind in 2010. And now I practice primarily obstetrics as a hospitalist now. Why did I leave reproductive medicine? I get that question a lot. I really began to see couples get split apart by the quest to have a child. I saw marriages begin to break down. I saw women, essentially, women become less than they were before. They became psychologically more distraught. They became different people than they were before because the stress of not having a child was just so incredibly high. And then when cycles failed, it even got worse.
And instead of looking at the underlying issues of what could be causing this, they're just wanting to, do the Clomid or do the in vitro and spending a lot of money in getting the same result over and over. And that seems to be the primary road that people are taking, but it's still a very ineffective path.
So we're going to go through the trauma of me being put to sleep to retrieve the egg, then put it in the petri dish, and the egg gets fertilized. And then you go through all of that and then nothing. A 25% chance of pregnancy is extremely low. We have a better chance conceiving on our own.
As I reflect on that first visit to the fertility clinic and waiting there nervous in the office and looking at the brochures and seeing the success rate, which I think was around 29% at that point, and thinking, oh my gosh, this is a significant investment of not only money, but my emotions, my hope. And there's very limited guarantee that this is going to work, and I don't even know what I'm going to put my body through.
I was sort of confused. When I went there, I thought I was just going for a consultation, and right away we did an ultrasound. He wanted to see, whatever he was looking for in there, and he showed me a pamphlet of this is what you need to do. He didn't really tell me I had any other options like, he just wanted to go straight for in vitro.
25% chance to conceive, 12% to carry to term or live birth. And I thought, 12 out of 100?
There's a certain amount, I think, of fear-mongering that happens around with women with fertility that, you're over 35, your fertility drops through the floor, your eggs are old, we don't have time, we need to act now. And I think that gets pressured on women a lot in a lot of the reproductive endocrinology clinics that, because you're 38, normally we would do a couple Clomid IUI cycles, but because you're 38 and your AMH level looks here and your FSH level looks here, we're just going to jump right into IVF with no prep to the body. And I just don't think when women are coming in working 60 and 80 hours a week and guzzling back coffee and eating convenience foods that's necessarily the best whole package for them.
I was 40, and the doctor told me, you need to be pregnant by Thanksgiving. You can't wait anymore. You need to do it now. And it was kind of scary because I thought, I didn't know how long I had or what my options were, but it just made it seem like, wow, he's like, when's your period? When are you ovulating? Let's plot this out and let's get moving.
But you have to remember something again about the culture. It's only been since 1970 that women have started to have their first babies after 35 years old. Before that time, the average age of first child was like 25 years old. I mean, now the average age of first child is approaching 30. And the difference in the pregnancy rates between those two things is huge.
It's being talked about in the media now that, all of these celebrities are undergoing in vitro treatment, and most of them are not getting pregnant on their first, second, third cycles. Amazing to me, actress Nia Vardalos of My Big Fat Greek Wedding has admitted that she's gone through 13 in vitro cycles with no pregnancy. And I just wonder what doctor is allowing that. Because that screams to me that it's all about the bottom line.
One of my patients said it best to me. She was like, there's a fertility doctor at one of the clinics downtown that has a really great success rate on the third IVF. Why is it the third? Why isn't it the first or the second? The thing that kills me about that is my patients that come in that are contemplating doing IVF, when we do chiropractic and acupuncture and Mercier, blah, 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 and everything else, and they usually get pregnant on their first cycle.
In many ways, women nowadays are getting the message that they somehow have their reproductive lifespan extended. That they don't understand that people within the reproductive world, when they're considering the people who are best served to offer donor eggs, are less than 32. It's no trick or excuse that the people who are recruited for donor eggs are in their 20s and college campuses and the like that, because those are the women who are the most likely to become pregnant on their own.
I feel in vitro has been publicized through the media and all of these celebrities doing it, so it glamorizes it. You look at these women that are in their mid-40s having in vitro procedures. Little does the media tell you they've gone through 3, 4, 5, 6, 7, 8, 9, 10 cycles to get that baby. So women, the regular consumer doesn't know that. They only know that this woman conceived and she was 45 and she had a healthy baby, and the numbers just are not there.
They were just in a really big hurry to just get me in there, try to get me pregnant, and move on.
Well, and the thing that was so concerning to me personally about working with a fertility clinic is when I went through all the tests they suggested, they couldn't find anything wrong. So when I started to go through the process, my husband questioned, should we even be doing this? Because there's nothing clinically coming up that's wrong with you.
And already he was like showing me the infertility binders full of, this is the injection, this is the medication, this is what you do on this day, this is what you do. It was very overwhelming, and I'm a nurse.
And that was a little disconcerting because at that point I was so desperate. I said, well, I don't know of anything else. This has got to work. And so, I was potentially putting my body in jeopardy out of desperation and the willingness of the clinic to treat me, even though there was nothing wrong.
Well, what is this? And he goes, oh, it's a shot you give yourself, IM in your butt every day. I said, well, I can't see myself giving myself a deep IM. I said, I don't, I told you I don't have a partner or anything, is there some other way? He goes, oh, you don't have to do that shot. And I said, well, what does it do? I mean, does it keep me pregnant? Or he's like, oh, it just prevents you from calling me in the middle of the night, with unnecessary bleeding or whatever. So I just felt like I went to a car dealer to buy a sedan, a nice family car, and I was like pushed into getting like a fast convertible or something. I didn't feel like he cared if I had a healthy baby.
We're trying to conceive a child here. We're not buying a new car. We're not buying a house.
You'll be pregnant in, 3 months or whatever. I mean, it was just like, this is what we're going to do. So it just felt, there was no, he didn't even look at the charts that I brought in. He just said, you're not ovulating. I said, well, according to the book,
And I told him, I said, well, all right, well, let me think about it. I said, I don't have I don't have a partner right now, and I'm not married. I just came to see what I need to do, and he took a California sperm donor catalog and threw it at me, and he said, just pick one. It's not an emotional decision.
And I really felt like everything boiled down to what I was on paper rather than who I was as a person.
People in general need to start to be looked at more as a whole rather than the collection of a series of parts. You know, when we do IVF on a couple, we first break apart the couple. Then we break the woman up from her actual organs, and then we do everything in a laboratory. And then we still break up the couple, even though they're there together, when we put the embryos back in.
You know, I remember sitting in the waiting room, going to the fertility clinic, going, should I really be here, number one? And I was alone. I wasn't with my husband at that point because we did look at it more as a medical process. So he initially wasn't involved. And then when I went for the more, extensive tests, he participated, but even the insemination aspect was so awkward and uncomfortable. And to your point, we really felt decoupled through the process.
Intimacy is interrupted when you have to give your wife a shot before it or after it, or, it just changes the whole thing. Oh, honey, let's try to get pregnant. So give you a shot and hopefully this is going to stimulate something. It's like, really?
That it does take a toll on its marriage, and it becomes all about the drugs that you're taking, which impacts your state of mind, which impacts, your hope, your despair, and that starts to weigh on a marriage. And, I can personally say it impacted our marriage fairly significantly. And then I think, depending on whether you get pregnant through that process or not, it impacts your marriage and your relationship longer term as well. So I think those are other factors to consider that I think people typically don't initially consider going into the process.
Well, sometimes it has to do with weight. So if I was overweight, I guess I would try to exercise.
And it wasn't any questions about, hey, what's your diet? What are you doing? No questions like that.
I think dietary changes are very, very important and imperative for women that are going to start any medically assisted cycle, whether it's injectables or in vitro. Our bodies are like a machine. We need to be eating a very clean diet prior to going to any conception cycle, whether it be medically assisted or otherwise.
It's not, this is always what we do for every person. I look at their blood work when they come in, and I look at the status of where they are and what they eat, and we make tweaks according to what's going on with them. Because just like fertility shouldn't be a one-size-fits-all approach, dietary therapy can't be a one-size-fits-all approach with people either.
You want to give your body the best chance, the very best chance right out of the gate. And that means no smoking, don't drink pop certainly, not even diet. And just eating the cleanest, most healthy foods. Drink plenty of water, keep hydrated. I used to work in an office, and the woman next to our office had IVF done, and it was her 4th cycle, and she had failed the other 3. The day after her transfer, I saw her in the parking lot drinking a Coke and smoking a cigarette, and I just wondered who her doctor was.
Well, I would first think that most people would then look at conventional wisdom, and they would go online, and then they would listen to their gynecologist, and they would then look to start fertility treatment. And I personally would probably look at all that, and then I would proceed to move on and look at more alternative natural methods like stress levels, diet, what I can do in as far as making my own personal changes on a more natural level. But I think that possibly it would only come after you've sort of done the mainstream stuff, because that's what you're expected to do.
When I went into the doctor and I had some of my initial consults, they did suggest that stress could play a role in the process, and they did suggest an acupuncturist as a possible option. They didn't really talk much at that point about diet or yoga or really any other more holistic or alternative methods, even supplements at that point.
We always encourage the patient to, prior to any kind of fertility treatments, for their general health to be in good condition. They have to be ready for pregnancy. And in that aspect, they have to have their thyroid checked. They have to make sure that indeed hypothyroidism is not going to happen when they are pregnant. They have to make sure that they are not anemic. They have to make sure that all overall nutrition is important.
Oftentimes, especially in the office setting, I do see that there's more of just let's put her on Clomid, and there's really very little monitoring of her other hormone levels or how she's feeling, whether or not she's even ovulating. Sometimes these things are done without even, looking at the ovaries, finding out if there are other problems with the ovaries anatomically or cysts there. So yeah, there just tends to be, let's write the prescription, here's what we do, but very little thought given to the overall general health of the woman. What is her BMI? What's her thyroid level? What are her other hormone levels? Does she have PCOS? Is she on metformin? All of these other things are such very important things that oftentimes aren't addressed.
I appreciate that everybody has time restraints, but doctors are so busy. You have to be your own advocate, and you have to be educated. If you're not educated about your own health and educated about what it is you're trying to accomplish with your health, unfortunately, there's so many people that just keep spinning their wheels, and they go through this vicious cycle of, either conceive and loss or never conceive at all. And it's just heartbreaking. It's heartbreaking to see what has happened to a lot of couples.
My sister for 8 years and did not produce a child. 8 years they went through. She had 3 different rounds of in vitro, and she did not produce a child. They stopped about 3 years afterwards. She went to a homeopath. She got herself healthy again. They went on vacation. She came back pregnant.
The one doctor just go on what's the name of the fertility drug?
Clomid, yeah.
Just do the Clomid and this and that. And she's like, no, you didn't even diagnose. You didn't check me out or anything.
There's another approach as well called Clomid, and the drug Clomid is being used to induce ovulation as well for women that don't ovulate, or the drug is supposed to be used for women that don't ovulate, but doctors, regular OBGYNs are using this drug to create follicles and help women ovulate just because. And they don't monitor them properly during the cycle, so they don't know if the ovary is hyperstimulating. They don't know what kind of progress is going on. They just throw them some Clomid and say, here, give this a try. If this doesn't work in 3 cycles, maybe we'll do 3 more, or maybe we'll do some investigation, or maybe you'll go to the reproductive endocrinologist.
No one ever explained that to us as part of the process. Oh, this is what this drug is for, that kind of thing. Or, you're not, but here's just a drug, go use it and go do it. It should work.
The only thing she recommended was the medication, trying a fertility drug. She never spoke to me about, how I was eating, any supplements I may have been taking. She never even offered to do any blood work or test my hormone levels. It was just, we can try the drugs. At the time, I didn't know any better. I'm like, okay, we'll try it. At that time, that's what we really wanted. So we gave it a try.
And at that point, we were kind of just on the verge of starting to think more naturally, and but that was that was our only option, we thought, was to go to the infertility specialist.
Our bodies are all different, so using the same approach for all women and timing their cycles and their stimulation and their egg retrieval and embryo transfer to be all on one cycle, it's just not a natural process.
And after a few rounds of Clomid, we discovered that it was making me severely depressed, really depressed, like just thoughts that you wouldn't want anybody to have. And so after that, with our fertility challenges, we just kept trying, but didn't really have any other help.
When I was on Clomid for about 6 months, for 6 cycles, it made me feel very strange. It sounds like a cliche, but I felt like I was outside of my body. At certain times of the month, I'd be sitting at my desk at work, and I would sit there and stare, and my whole body was just kind of felt numb. It was just such an odd feeling.
It is so important, first of all, to understand and explain to the patient that this is not a fertility drug. This is ovulation-inducing drug with a price tag to it, and the price tag is to be anti-estrogenic. These patients will develop a very poor mucus and will have a lining of the uterus that is fairly thin in many times. And then while you're making the patient ovulate with the usage of HCG injection to release the egg, but the ability to achieve a pregnancy is limited because of these anti-estrogenic effects. If you don't monitor the patient to document these things, you're basically missing a point.
But Clomid is actually contradictory to a healthy ovulatory cycle. It's estrogen inhibiting, and we need estrogen present when we ovulate and start to grow a baby. Estrogen is what forms the vital organs of the baby. So it actually can put a woman in a harmful place.
You know, the OBGYNs, first of all, they're surgeons. And secondly, they're seeing all of these women. It's just such a broad spectrum of women that they're trying to treat. And they have very busy days in the office from early morning, you know, with surgeries early in the morning, and then in the office until 7 or 8 o'clock at night. And I just think it would behoove all of them to understand that there are so many other people out there, people doing Mercier therapy, or, you know, just even other disciplines with clinical nutrition, areas like that, where they could be referring these women to really help pull together a bigger picture of their overall health and needs. But I think they just get so overwhelmed with the volume of patients that they're seeing, and they're so driven by medicine oftentimes that, you know, that's an easy fix. So let's try this, let's try this.
Anytime when we give medication, first of all, learn if a patient has no periods at all, you first want to know, is it a uterine factor? Is it ovarian factor? Is it pituitary factor? First make your diagnosis as far as what is the source of the problem, and then you will be able to go easily into the correct treatment without guessing and saying, let's try this or let's try that.
Ovulation and conception is a very natural process. And if that's not working appropriately, then we have to examine why it's not working and not take the steps forward to stimulate that cycle. There's obviously some underlying issue that needs to be addressed prior to doing that. And that's what I work so hard to try and teach my patients and physicians, that we need to incorporate movement and more blood flow to the area and then go to the stim cycle if that's indeed what is indicated.
I think that the patients have to have their bodies in balance in every way humanly possible. Dietary, visceral manipulation, anything that we can do to get there. And I've seen it in my practice. I've seen it time and time again, where people are coming in on their 3rd or 4th or 5th IVF cycle that hasn't worked, and they're like, oh, I heard acupuncture can help. And I'm like, look, we don't just do that here. You know, we do Mercier therapy, we do chiropractic. If you're 41 and running an ovarian reserve and this is what you're looking for, like, I understand that time is not necessarily on these women's sides, but for them, I'm like, you need to give me a little bit of time to try to get your body in balance. And they're all like, oh, I'm so sorry it took me so long to find you, or I'm so sorry it took me so long to listen. And they deep down inside, they knew something was not right. And they had to go seek it out themselves, because it's not like the people in the reproductive endocrinology offices are looking at them and saying, hey, have you tried visceral manipulation, or have you tried acupuncture, have you tried chiropractic? Like, that doesn't happen, and it should.
A physician has to be obsessed on trying to come closer to the truth of what is going on. And the way to do it is to screen the patient to start with. Get a feel of their physiology. Understand the patient physiology before you start throwing on a patient any medication at all. And by the way, if we give Clomid, for example, on a patient, it is a weight-related dose. You don't just go from small dose to higher dose.
So many risks. I mean, women get depressed from utilizing the drugs, and they get irritable and have anxiety, and nobody's really addressing those things. They're just left to their own defenses. And when you come work with me or someone who's trained with me, we walk with you through the process. You're never left by yourself.
What did you think about, I was kind of concerned about the AMH. You're not concerned about it?
No.
Okay, because I wasn't sure, like, you know how you Google things like to men, and at first I'm like, oh my god, this is low, but then the doctor said it was in the normal range. Yeah. But I still was like, I want it to be higher. I don't know, because
you know what? But your FSH looks really good.
That's what he said.
Yeah, if your FSH was higher, coupled with a lower AMH, then it'd be like, well, maybe the ovarian reserve is a little bit diminished.
Yeah.
But both numbers coupled together, they look good.
Okay.
They look good.
That's really.
We're right there with you, helping to monitor your cycles. But with in vitro, these clinics are simply too busy to walk with you through it and hold your hand and help you with the emotional part.
You know, I mean, like I know some people who did in vitro, now they have like cervical cancer. You know, I don't know whether or not, they were told that that's something that could happen. I'm sure if they were told, they might not have gone through with it,
They're taking bacteria and fungi and putting them in cells. It's recombinant DNA. Like, what from a DNA damage standpoint is that doing to women? I mean, it's been well documented that, that there's certain tumors with overgrowth that have DNA damage to them that looks similar to some of the stuff that we're engineering for these medications. Like, is this increasing women's rates of cancer?
For those in my family who did go through menopause early, at least one in particular I know underwent a lot of medical interventions in terms of trying to get pregnant. Many, many years of trying to conceive through different IVF and different, injections and you name it, unsuccessfully, and ended up having at the age of 40 a hysterectomy just based on all of the problems that she was having at a young age. And I don't know for sure if it was linked to the chemicals that she put in her body. My suspicion is it was, but I obviously don't know for sure. But just to have to make that choice of all of the things that your body is putting you through because it's rejecting chemicals that you've injected into it over years, all for the sake of trying to get pregnant.
He never once mentioned any, potential side effects, nothing. I just think that, once you're a certain age, you're like, this is it. You feel like this is my only choice. I have to just accept whatever he could do to get me pregnant, worry about the consequences later. That's how I felt.
When patient going through a variety of treatment, many times it's so important to have the patient participate in the process. And your side of the story as a physician is to be able to feed them the correct diagnosis, the condition that they have to face, and let them deal with this entity of how they want and how they feel comfortable resolving it. In many, many conditions, we see that the patients had not been part of the process in which they walking into an assembly line in which a variety of orders are given to them. As good patient, they try to actually listen and perform everything that they are being told. But it's so much easier when actually they are participant and they feel comfortable what they are doing because they know why they are doing it. And that kind of preconditioning of the patient is very, very critical.
I don't really know. I guess I think I've heard a little bit about fertility treatments, and I think that would be far in the distance. That would be like maybe a last step. Maybe I would go to some sort of holistic doctor or someone that I heard about and try other kinds of things, like anything that didn't involve medications or anything like that first.
Of course, I would have a discussion with my husband and learn about alternatives and options out there.
If there was a viable alternative method, non-surgical, no drugs, that had very good statistics, would you be willing to give that a go?
Absolutely. Yeah. I mean, anything that was non-invasive and, I mean, in terms of medication and shots and all of that kind of thing that I know that women have to go through, to try and become pregnant. Yeah, absolutely. Something new.
Using Mercier therapy for infertility is probably the best thing that can be done. From my understanding on how that works, and using that as a foundation to treat infertility is probably paramount. I mean, it really should be the first line of defense to treat that issue.
So this sort of manipulation, I know it's a little bit uncomfortable. Yeah. But it's like turning on a light switch to your ovaries, because we're actually restoring the blood flow just by pressing on the ovary and then letting off. And that helps to bring a nice solid ovulation. Because these ovaries might have been quiet for a while, and that's okay.
The work is preparatory. I mean, you have to do that work. It's going to only enhance the medically assisted cycle that you're about to endure, and it can only make things better for you. Even if you do fail that cycle, at least you know that your organs are mobile, there's adequate blood flow there, and we're doing the best that we can. It's an extra step for you to take to ensure that we're going to have the best first cycle instead of moving on to the second or third. And if that happens, then so be it. But at least we've done the preparatory work in preparation for the more heavy-handed approach.
By having a solid foundation on which you build your house will only drastically increase your chances for conception and well-being in general, whether you're talking about discontinuation of smoking, to healthy eating, to losing weight, to whatever that issue may be. You have to have a healthy foundation.
We've had patients that have gone through cycles that have come in and have done IVF cycles in the office that had a very poor response to medication. We give them 2-3 months. We do chiropractic, we do visceral manipulation, and we do dietary therapy. And all of a sudden, the same protocol works on them where they were making maybe 6 follicles. Now all of a sudden they can make 14. Do you think that's just the body needed to be primed up in response to drugs? Totally not. It's the body's capability to be able to have the blood flow possibly to bring that medication there, but to help augment their own hormones as well.
I would definitely recommend Mercier therapies for preparing and for any medically assisted therapy. Restoring balance and proper function to the organ only optimizes their chance for pregnancy.
Fertility aside, this is something about optimizing a woman's wellness. When I have women that come into the office that are having pelvic pain, and the pelvic pain is totally overlooked because it's the fact that, they want to have a baby and they want to get pregnant. And that gets overlooked as in, well, let's just stimulate with some medication so that, we can temporarily hijack your body and take all these eggs out and play, let's take the best looking sperm and put it in the egg and we'll present that back in your body. How does the doctor that's in there know that the position of their uterus isn't an optimal position for blood flow? Is this part of their success rates that, are 22.6% potentially?
You're talking about circulatory health. Paracelsus said there is but one disease and its name is congestion. So any area of the body that gets congested is going to be the area where disease can get hold on, and I would include mucus plugs in the fallopian tubes as part of that disease. If the fallopian tubes can't move and expel the mucus, then it's going to be hard for the egg to travel down the tube and get impregnated in the first place.
We are the only country that does not rub the belly in massage therapy. They do it in China, they do it in India. You can talk to anyone that's foreign born, and when they were ill or they were having problems, their parents would rub their abdomen. We don't touch the belly here. And although it's taught in massage therapy, I have yet to go get a massage and ever have my abdomen touched. So why is this, which in chiropractic is the front of the back, is not touched?
Mercier therapy to me is just a great common sense approach to helping women conceive, because you are bringing back the mobility and the natural function and position of all of the reproductive organs so that you're getting the blood flow to the organs properly, making sure that they're in alignment and communicating with one another. Definitely a baseline place to start to make sure that everything is in their proper functioning order.
Malposition of any organ in the body will impede, ultimately, proper function. It's just like having your leg crossed and your foot falls asleep because you cut off the blood flow. If you left it like that, the foot would start to lose its function, period. So it's not being addressed anywhere in women's health that if a woman has a malposition or a buildup of scar tissue in her pelvis, that it would impede function. And it needs to be addressed, and it needs to be addressed quickly.
Well, Mercier therapy, which I've learned quite a bit off and on for the last number of years, it seems to be a cross between massage therapy and osteopathic therapy. And frankly, understanding Mercier therapy requires us to understand some of the baselines of osteopathic therapy, which was also designed to try to restore women's or men's function by using manipulation therapy.
I think it's been pretty well demonstrated that organ malposition affects the function of that organ. You're talking about the forces that go through it, how the fluids flow through it. So what other movement do you do 20,000 times a day? You breathe about 20,000 times a day, depending on how fast or slow you breathe, and no movement is repeated as much as breathing is. And when you come down with the diaphragm, you're pulling down on the lungs, you're pulling down on the heart, you're pushing down on the liver and the stomach and the spleen and the intestines and right down into where the pressure is greatest, down in the pelvic bowl. So that the organs are able to respond to that kind of jellyfish. It's very much like a jellyfish, the motion of the diaphragm. And every organ needs to, in my opinion, respond to that motion of the breath. The body works better when all of the organs are responding to that. It's actually an issue with hysterectomies as well. When you just take an organ out of the body, it doesn't fill in that space in the same way that it did originally, so the body falls on that. If you're holding a part of your body really tight, then that motion of breath doesn't go through, doesn't have those organs responding, and therefore they start to malfunction.
The creation of Mercier therapy just came naturally to me. I thought about the space in the pelvis and all of the organs, and how if they're stuck in place, we just need to get some movement back in there, just like with any part of your body. If you have a shoulder injury and you're not able to use your full range of motion in the shoulder, we have to rehabilitate that, get the blood flow going back to it, get the movement going back to it. It's the same thing with the uterus and the ovaries, especially if it's a little bit of an older woman beyond 35 trying to get pregnant. That area has never been used, and it was really intended to be used for pregnancy at age 20. But some of us are waiting. I'm one of those women. I was pregnant, with our daughter at age 36. So naturally, I had my own work done on me. You're moving the uterus in several different directions, which means you're lengthening ligaments and you're softening the surrounding structures in the pelvis, including all of the musculature and the organs themselves. But in that process, you're also creating blood flow to the entire pelvis, which can only be helpful.
And we do abdominal massage, even Mercier therapy on people just with back pain. Because are the adhesions that are in the front of the abdomen causing the problem that's giving the issue for the back?
And the front of the sacrum, it's pulled to its tension because this uterus is so taut in its upright position. So that would accommodate for why you have some low back discomfort.
Is going to lessen adhesions, that is going to help to stimulate blood flow to these organs, that is going to help in relaxation of these organs, possibly changing position of some of these organs. And I think this is wonderful. I think this is a wonderful approach.
So the way that organ manipulation can aid the organs is if the organs are, we could relate it to the nervous system, to the circulatory system, and to the myofascial system in this case, if we're thinking about the uterus and the fallopian tubes. We're talking about the fascial system, the way it's held into the fascia. So neurologically, if there's an area that has dropped off the map of the somatic body image, then organ manipulation can help the nervous system by bringing the nervous system back to that area. So if you have an area of what's called sensory motor amnesia, if it's not being moved, it isn't felt. If it isn't felt, it can't be moved. And that cycle, that sensory motor amnesia cycle goes on until that part of the body is not moving as much. Most people have one hip that is less mobile than the other. They have just grooved into a pattern of gait that doesn't have the hips move the same. and that's going to affect right into the uterus, the ovary on one side. So frequently the ovaries and fimbria and tubes can be pulled forward, pulled sideways, tilted, or rotated by the forces coming mainly from the hips through the pelvis or down from the spine into the pelvis can affect how the uterus is going to sit.
Positioning can help.
Yeah.
And manipulation to help positioning. Playing with it till the cervix has a straight shot, great.
Yeah.
Give the cervix a straight shot. Well, I mean, if you were placing an IUD, you do the same thing. You manipulate the cervix so you have a nice straight shot.
Well, yeah, you think about a retroflexion.
Right.
All the way flap towards the back.
Right.
So women that do become pregnant with a retroflexion can have bowel issues and tailbone pain, sacral pain. So even if we have a retroflexion, but incorporate more movement for the organ, for the uterus to be able to move, that's my whole thing.
Each person who undergoes the therapy, they're going to have their own individualized response. And that's going to be what the final evaluation of what this particular therapy is.
Funding for publications comes from the government and comes from the drug companies. And for an independent doctor to sit around and do research that's not case study driven, it's a lot of time, energy, effort, and money out of their own pocket. And this is why you don't see a lot of research coming out of, unless they're somehow affiliated with a university, alternative medicine.
The usage of pelvic manipulation is directly relates to blood flow. And one can document some patients that are having serious issues regarding the blood flow around the uterus and the ovaries by a Doppler ultrasound. Manipulation has the ability to change some of these parameters, although there were not really studies that showing the blood flow changing from that. But we know that there are some patients that would benefit from it.
Well, it always cracks me up when they're like, it's not a double-blind, placebo-controlled study. Because what in the body can you actually really take out as a component? I mean, it's like all the acupuncture studies where they're like, the sham acupuncture studies show that acupuncture is really no much better than a placebo. Well, because guess what? Neuroendocrinology-wise, when you poke a needle in a person, there's still an effect. So how do you do sham acupuncture? How do you fake thrust on a joint for chiropractic research? So this is where, the MDs get on us about, your research isn't double-blind, placebo-controlled, which is the gold standard in research,
I think breast therapy should definitely be one of the first things that we do before we move on to more invasive or certainly even more costly interventions.
I think without preparation, you're wasting your time. Mercier therapy would be, again, a first line of defense to optimize the whole functionality of the reproductive system before any medical procedure or insemination, period.
Going into a medically assisted cycle and not having proper physical preparation is like running a marathon and not stretching or preparing your body ahead of time. It's blindly throwing your body into a scenario that requires pre-training.
There are many reasons for infertility. I would have thought in every practice of medicine that the use of a less invasive method before the use of a more invasive method is always indicated, especially a cheaper method. And keeping the pelvis moving, we sit so much. We just don't get the circulation through our pelvis that we need. Belly dance was not originally invented for men. It was invented as a birth preparation dance. It's also a good fertility preparation dance, is to get those hips completely moving, because it may not be obvious from the outside, but the two bones of the pelvis move separately. They're like two propeller blades, and they move slightly on each other as you walk or as you do the belly dance. And that provides a fundamental circulation from the skeletal system, so to speak, into all the organs. So any kind of movement that you can do in preparation is good preparation for the birth that's to come, which is a place where I'm quite passionate that if women want to give natural birth, they should be training themselves up for natural birth. And if you're looking for a fertility, the prescription is the same, to get that part of the body moving so that there are no places of congestion and fluids are flowing through that area.
feel the statistics spoke for themselves. When you look at it, Dr. Jenny's rate of success is about 83%. So when you look at 29 versus 83%, and just looking at it monetarily, the investment, it is much less than what you look at from a fertility clinic. And also, too, just a toll on your body. And you get so much more out of it just from a value perspective because Dr. Jenny is there looking at you as a person, as a woman.
Finding Mercier therapy was a great story. It had been several years since we had tried fertility drugs, and at that point, we were just kind of coming to the sense that it was meant to be, that perhaps we weren't going to be parents. And it was late one night, I received an email. I was sitting at my computer, I received an email from a friend who said, hey, you should check out this video. It's a friend of mine who got pregnant through Mercier therapy. And I watched a video of Dr. Jen's, a client of theirs who had gotten pregnant after the therapy, and I cried.
I had actually started taking yoga, and after my last significant miscarriage, I was pretty just upset and distraught. And my yoga instructor actually had worked with Dr. Jenny with great success. Additionally, I had a very good friend who had worked with Dr. Jenny, and both had become pregnant. And I thought at that point, you know what, it can't hurt.
Came to Mercier therapy because I was getting treated for my emergency C-section and for recovery from that, because I knew there was scar tissue that needed to be broken down before we tried to get pregnant. So I wanted to kind of have an overview and a good place to start before we tried.
I was struggling with my own pelvic pain and fertility challenges from the age 26 on, and ultimately at age 35, when we wanted to start having or trying to have a baby, we noticed that there were some delays in that happening. And so I had my third laparoscopy done, and immediately after the laparoscope, the surgeon told us that my organs were in very poor shape and that we probably should proceed forward with in vitro protocol. And that didn't settle right for either me or my husband. So we went with a more natural approach, and we tried a few insemination cycles with no drugs. And to no avail, nothing happened. And ultimately, I had a group of my professional students work on me, and the next cycle we conceived naturally. And I was just amazed. And that further deepened my intuition that, a study needed to be done. Something needed to be done, because if I was one of the toughest cases, according to the reproductive endocrinologist, then certainly I did something that was a bit magical. Something happened.
And so by the time when we heard about Dr. Mercier, it was like, what in the world? Like, there's still something else. After the acupuncture was kind of like, this is it. It seems like I don't know of anything else. But so we've tried the diet thing. We're still trying it. Whatever.
We'll keep going on those things, but...
Yeah. So then, when Heather had told me about it, I was like, oh, maybe there is still some more hope. But, obviously Heather's really excited. And I'm like, not skeptical, but I'm like, yeah, sure, let's go for it. Let's go for the next one. So let's try it. So
we have nothing to lose. We only have something to gain.
Using Mercier therapy, we completed a 4-year ongoing evidence-based research study in which 83% of all participants achieved pregnancy within 1 year, as compared to IVF's 29% success rate, which is extremely invasive.
A friend from church emailed and didn't know a lot about our infertility story, and but she had said that Dr. Mercier was doing some research and needed some patients for research, and so we were very, very excited about that possibility, and contacted her right away, and we're glad to be a part of it, a part of the research group for her. And I just thought after at that point 10 years of infertility, if she had such a high rate of success, that I thought, well, this if anything's going to work, maybe this will.
So is that, and then just a hope that, hey, and it was an hour and 15-minute drive. Like, let's do it. This is worth the drive because, hey, maybe it will work when we don't know. So
Right.
And I think for me in hearing this, well, what Heather would tell me about Dr. Mercier is hearing the success rate. Like, really? And you hear these stories and you're like, come on. Like, you have your skepticism. Like, come on, we're going to be the 2 that don't. Yeah, it's like 8 and 10, but we're going to be the 2. Because that's what we had heard for 11 years. That you just need to relax. It's all, something you're doing, blah, blah.
Right. Just because you adopted, now you're going to get pregnant, or it didn't happen,
As someone with a bit of medical knowledge and a natural skepticism, I was expecting the incense and waving a feather.
I have a 4-year ongoing evidence-based research study that shows that 83% of the participants in our study became pregnant within 1 year of finishing our protocol. And a very few of those ladies had to use any sort of medical protocol. Most of those cases were standalone, meaning we helped them monitor their ovulation cycles and become pregnant on their own.
Position of the organs affects function has been very well and amply demonstrated, and one of the reasons that we speak to the myofascial system in the work that I do to bring that kind of balance into the body movement, because that also conveys that sense of movement and health to the nervous system and the organ system as well.
I've studied Mercier therapy, and this topic for me came up about 6 or 7 years ago with women who were seeking someone that did visceral manipulation to help augment fertility challenges, not just for fertility, but also for painful periods or dysmenorrhea, and a host of other gynecological problems, in the hopes that they didn't have to go in and have, arterial embolization for fibroids or DNCs or things along that line. And the assistance that it's given our patients for both fertility but also a postpartum has been fantastic.
Each woman and the couple together need to be very proactive, and they need to have someone who's an advocate for them all along the way, because I think just culturally we have such a narrow view of how to help women with infertility issues, and Mercier therapy seems to have a much more broader span of thinking, whether it's nutrition or the visceral manipulation, getting all the endocrine issues a little more underhand, and collaborating all of those different disciplines to work together. And Mercier therapy provides that, and then has the hands-on along the way to help them when these things are coming up that they're not familiar with.
Our job as healthcare practitioners is to educate and inform women, and to give them choices, to give them the pros and cons of every avenue that they have the possibility of doing to help them achieve the results and achieve their success. And she has that same standpoint in putting the patient paramount first. It's not about money, it's not about ego, and it's not about personal gain. It's about the patient, and that's where healthcare should be, and that's what Dr. Mercier does.
Immediately clicked, got to talk to her and explain to her what my issue was. And so I thought, why not first try the holistic approach and see before I even go the route of drugs, because I do not believe in, not that I don't believe in drugs, but the less I had to put into my body, the better off. That was the better off choice for me.
Collaboratively working with as many different disciplines is going to be the wiser approach, because the more minds that are there and have an expertise in these different areas, whether it's Mercier therapy or clinical nutrition or reproductive endocrinologist or the woman's primary care physician or OBGYN, all of those minds and different experiences working together are certainly going to have a lot more positive outcome, effective outcome for the woman.
Collaborative approach is necessary for fertility care for women. There's no, like I said, there's no one-size-fits-all approach to fertility in women, and I think we need to look at the female and their partner that's coming in as their own distinct unit and customize a program for each couple that's coming in to help them achieve their optimal success. So it's not important. It's something that should have been done years and years ago. It's necessary.
I see women coming into my office that have gone right to in vitro, and I think that's a very, very heavy-handed approach out of the gate. There are simpler approaches that can be taken first, and that's exactly why I like to work with Dr. Benor. He is a very conservative physician, and he takes into account the patient's health and safety first. He's more likely to use an injectable FSH protocol with an ovulation induction with an injection first, as opposed to going right to IVF. And I really appreciate that about him.
Basically, we offer everything that is out there. It really comes down to what the patients will need.
And you typically don't find this. I've had a lot of friends go through infertility as well, and they've gone to some clinics where there wasn't kind of the personal care and attention that Dr. Benor gave us. To have him recommend to us to seek some additional help through Mercier therapy, I thought was really great. Dr. Benor and Jenny, they understand how to work together.
There's no question that the right, in order to go into any in vitro fertilization processes or artificial insemination with induction of ovulation, etc., the patient has to be well prepared. First of all, she has to understand what she's getting into, what is the process, and it is very important that the physicians overall, prior to initiating it, will talk to the patient. Let the patient herself figure out what she feels comfortable with, and let them make the decision if this is something that suits them. There are going to be some patients that will be against in vitro fertilization for a variety of reasons. If it is psychological, if it is religious, if it is any or mental concept of all the intensity that goes with this therapy. And some of them will actually will need to think more than the average in order to make that decision.
For couples that don't know and first want to try before you go and have a major surgery, I would definitely recommend to try the holistic approach, try the more natural approach and see, because going through IVF cycle is definitely not an easy process. Having to inject yourself with medication, you don't know how your body's going to react to it. And that's why I went with that approach first. Was kind of in a way too, I could say, yes, I have tried this route, okay, let's try what is that route, instead of first just going in and have a surgeon, do a major procedure.
Families who lose their life savings because they want to have a child, and then there's nothing left to even adopt. So, my only recommendation is to always try to go holistically. Mercier therapy is phenomenal because it gets you in alignment, and the approach is from the emotional out, and that's what you need, because trying to have a baby is an emotional issue, and if you are stressed out emotionally, I'll never forget that. That is in Dr. Mercier's book, where she had a patient who could not get out of her negative emotional cycle, and she never ended up conceiving. And I know a lot of women who don't conceive because of that, and I didn't want that to happen to me. And it is very difficult to control your emotions. It is very difficult because having a family is the most natural thing in the world.
Jen Mercier has written the book, Optimal Pelvic Health, and that gives a very good overall cursory overview of things like PCOS, endometriosis. And I think, if some of the practitioners could read these books or, her abstract that was in Midwifery Today, just helping them to have a better understanding of what exactly Mercier therapy is, and that she does have a mindset of really wanting to collaborate with the primary care physician or the infertility specialist in helping find a best solution for each individual woman.
And how many people have we done this for women with endometriosis, for women that have had surgeries because of ruptured cysts or endosurgery, or even women that have had appendectomies. I mean, that scar tissue is tying up a lot of what's happening over in the, over on the right side, the right lower quadrant. So they're over in their fallopian tube is getting traction. Is their shut down fallopian tube because of scar tissue? I don't care how many hysterosalpingograms you have. That's not going to blow that scar tissue out. You have to reposition that so that the tube can open, so that ovulation can happen and the egg can descend.
I guess if I had to compare the treatment that I received through Dr. Mercier and the treatment that I've received from my general practitioners and my OBGYN, yes, it was much more natural, and I felt much less drugged. I mean, I lived on painkillers for probably 4 or 5 years before I saw Dr. Mercier. So it was very nice to not feel drugged all the time, to be able to have a conversation with my doctor and my physician who actually had a conversation with me. It wasn't just instructing me on something or telling me not to do this or to do this, but understanding how you felt and how I could change things or could make things better for myself. She was always very good at letting me know what was going on and know what I was taking and know what she was doing, what she was pushing on and why she was massaging that section, that area, what that was going to do for me, and what the supplements would do. Like, there were supplements involved and they were fabulous and wonderful without drugs. And then finally, the fact that she collaborated with my OBGYN. He actually mentioned it to me too in my next appointment, that she had called him and talked to him about what they could do with my medications and with my hormones to try and help me live better, have a more, I don't want to say better quality of life, but better quality of life without painkillers.
The most awesome thing about Mercier therapy was it was so natural. No medical intervention needed. Everything was a holistic, natural approach, which is exactly what I needed. Going through the therapy, it was, it wasn't painful. It was relaxing. My body felt great. And I was so excited to have found such a natural thing that I was comfortable with, and I didn't have to worry about side effects or anything else.
It was a good response. Like, I knew that my body was responding to what she was doing, and I was hopeful about it. And after the second and third sessions, even more so.
I stayed at home with our 3 boys, and I absolutely love it. But that day I got to just go get a massage. The days when I got to go work with her, and she was just automatically like a friend, and we just talked and got a massage in my belly, and Jonathan played with the boys at the park. Just so relaxing, and such a beautiful office and environment, and Dr. Mercier has such a hospitable spirit and just makes you feel comfortable right away, and so I had a lot of fun.
She would do what you call the pelvic massage. She would go in, so to say, massage and I think what we got to find was, I remember saying that my uterus was tilted backwards. And I think that's the same too, that the fertility doctor said what she was trying to do was to manipulate or massage my pelvic to have my uterus turn in the right position.
So from a protocol perspective, what I really felt was beneficial was not only the supplements that I was taking, but also the pelvic massage. Having 3 miscarriages as well as a C-section initially with my daughter, Dr. Jenny really explained to me the impact that scar tissue can have on maintaining a viable pregnancy.
She could feel that my uterus was in a weird position. She said it was bent backward, retroflexed, and the top of it was bent over on itself. And the muscles in my pelvic area were very tight, certain things were going on, and so her goal was to loosen that up. But afterward, I just thought, okay, she felt my uterus. She's going to put it back into position. And that's all it takes. That's all it takes, and that could be the answer to our problems. And that was just the most amazing thing to me. To think that so many people, even we could have been candidates to go through much greater interventions medically to try and get pregnant. And something as simple as this is all it takes. It blew my mind.
My whole reproductive system came back to what it should, in that I started to have 26-day cycles. Even at the age of 42, I was not, all my tests indicated that I was not perimenopausal. All the tests indicated that my eggs were of a good age. In fertility terms, that means conception is viable and possible. My periods weren't horrifically painful anymore. The prenatal vitamins that I had been taking really helped with my energy and my moods, and I wasn't so in such despair.
The important thing is that it almost feels, in my opinion, the pressure is taken off the couple and the woman going through the Mercier therapy process. I felt going through, a fertility clinic, it was so expensive. There was so much emphasis on focus around kind of key milestones and what you were trying to achieve at each of those. You started to feel like, what's wrong with me if I'm not ovulating? What's wrong with me if, the Clomid's not working? What's wrong with me if everything seems fine and this process is still not working and I've been inseminated and I'm still not pregnant? So there was more stress. I felt in working with Dr. Jenny, I went through the process focusing more on myself as a woman, more on my reproductive and my genetic makeup, and what was important and what were all the components that needed to be right to get pregnant. So I think by de-emphasizing trying to make a baby and focusing on me as a woman and what needed to be right and in balance, that really helped me feel more secure in the process and not as stressed out.
So with the Mercier therapy sessions, one of the coolest things was they were intense because it was breaking down scar tissue. But my forest yoga training helped me use my breath to breathe through it and release the tension, similar to how a deep tissue massage works. And what I found even more interesting was coming back onto the mat. I was able to find space or awareness in different places that had been locked down or shut down because of scar tissue buildup. And so that was, in addition to getting pregnant, I was able to get more freedom in my body.
The experience is so unintrusive, and you're not doing anything to your body that feels mechanical or manufactured, and it just all feels very natural.
There's a calmness and an assurance that comes from her completely understanding where you're coming from and the frustration that you're going through.
So it was a very relaxing atmosphere, very relaxing process to go through. It's almost like going for a massage. Just sit there and just close your eyes and relax.
With the massage that I received through Mercier therapy, that specifically addressed the problem with my pelvic area, the uterus being misshapen, everything needing to be prepared to accept, everything that needed to happen within my body to achieve that pregnancy. Alongside that, though, Dr. Jen also has a protocol for taking care of yourself with a regimen of supplements. It's a personalized protocol where you sit down after the lab work comes back. She assessed what I needed based on my body's needs and recommended the supplements that I needed to be on. I was low on progesterone, so she had me be on that. Just everything that was customized for me. The big picture of what we were trying to do was extremely effective. Mercier therapy was the reason I got pregnant. It was effective in helping us have a child and carrying my child to full term and having a healthy baby.
Any way in which we can achieve an improvement in that natural means to become pregnant probably is going to be the safest, best, easiest to be used, and frankly, probably most successful for the couples that seek to become pregnant.
All of the organs, including the organs of the pelvic girdle, which are under the most pressure down in the pelvic cavity, are tied into the body wall with fascial layers that literally support the organ where it should be, or don't, as the case may be. And visceral manipulation and that kind of osteopathic preparation for birth, or for fertility, or for birth, there are demonstrated results.
My therapy with Dr. Mercier was the only reason that I ended up getting pregnant ultimately and delivering a healthy baby.
It was towards the end of the therapy that I conceived. I believe it was a 12-week session, and I think somewhere around the 10th week, I had conceived my second daughter.
We went from our first child, it taking 3.5 years to get pregnant, to our second son was conceived within a matter of 3 months from working with Jenny.
After 10 months of continuing to try to conceive, we did conceive. And so far the baby's very healthy and we're thrilled about it.
This was the critical piece that worked to help us start a family.
As the months went on, and it was, I think, maybe 8 months since it had ended, and I thought, oh, yeah, I guess I'm one of those women that, doesn't get pregnant within the year of... And then, all of a sudden in November, we were pregnant. And we just couldn't believe it. I mean, 11 years, 13 years of marriage and 11 years of trying all sorts of things and nothing. I mean, we'd never, ever gotten pregnant before, never had a miscarriage, nothing. There'd just been nothing for 11 years, and we just couldn't believe that we were pregnant. So I definitely, there's no doubt about it that made such a difference in us getting pregnant. We just still can't believe it.
There are many different ways to approach fertility, but ultimately, I think every single couple has the goal of having a healthy pregnancy and having a healthy baby. At 43, my doctors kept, treated me as if I was high risk, and just because of age factor alone and all the trends and statistics that they put out medically, and yet I had a perfectly healthy pregnancy. I did not have hypertension, I did not get preeclampsia, I did not have preterm labor, I did not have gestational diabetes. I stayed on my thyroid medicine, I stayed on the prenatals, I took everything that I needed to, and my pregnancy was virtually problem-free. And anytime you go through therapy, that is your end goal. And I think Mercier therapy is the best option to start with, even if you're going to go with IVF.
Maybe it's too good because she didn't want to come out.
At that point, it's kind of hard to be a skeptic after trying for 12 years, in essence, should remove the skepticism out of it, and certainly did for me.
There's so many times in this 11 years where it'd be like, honey, I know I'm pregnant. I just know I'm pregnant, and you take the pregnancy test, negative.
Or just,
I know that test is wrong. That test has got to be wrong. We got to be pregnant. And so I was like, honey, I'm not gone there. Like, it's too painful. There's too much pain and like getting excited and doing this, and then there dashed hope. So Heather shows me, he's like, John, I think, look, it's starting to change color.
There's a little bit of a line.
And after 11 years, right? So I was like, no, come on. It's probably...
It's too light.
Yeah, that's part of it. Come on. Like, we've been through it. Like, it's not working.
I'm like, no, it's not like an ovulation test. It's a pregnancy test. Anything is a positive.
Yeah. So then when it was totally solid...
Then it got really dark, and he was like, wow.
This is for real. So, yeah.
But again, what's happened is part of the development of these kind of therapies that have come, that Mercier therapy is one of those therapies that definitely can help people as they move into their reproductive life, as they continue through their reproductive life, and at the end of their reproductive life as well.